We're a little over 3 weeks away from the start of the Centers for Disease Control and Prevention funding announcement of the Comprehensive HIV Prevention Program for health departments. Many of us refer to the announcement as the FOA, the Funding Opportunity Announcement. Or is it the finale of African American agencies? This two-part blog series on the FOA will have many questions that I hope collectively we will be able to provide solutions to. Please post your comments to help provide more insight on how the new funding announcement may affect Black agencies. A little background on the FOA. Its title, Comprehensive HIV Prevention Programs for Health Departments, includes 3 categories. Category A is the HIV Prevention Program of Health Departments. That's the core funding. All jurisdictions were eligible to apply. Category B is expanded HIV testing for disproportionately affected populations. This category was limited to certain jurisdictions who met the criteria to apply for it. And the final category, Category C, demonstration projects, was a competitive process that all jurisdictions could submit an application for and compete for funding. There are 5 major outcomes expected from the new funding announcement. The first being decrease the annual HIV incidence rate in communities where HIV is heavily concentrated. The second being decrease the rate of HIV transmission by HIV-infected persons. Third, decrease risky sexual and drug-using behavior among persons at high risk for acquiring HIV. The fourth, increase the proportion of HIV-infected people in the United States who know their HIV status. And the fifth and final one is increase the proportion of HIV-infected persons who are linked to prevention and care services. Now, this funding opportunity announcement is limited to health departments or their bona fide agents. There are several directly funded cities or county health departments in the announcement. However, in most cases, the state health department will be the grantee. The announcement's funding methodology caused some shifts in resources. Unfortunately, we don't have enough time to give an in-depth overview of the methodology used or the impact that some project it will have on domestic HIV prevention programs. What we do know is that there are some jurisdictions who will receive a reduction in HIV funding. There are other jurisdictions who will receive an increase, or they may receive an increase by having a directly funded city within their state. Another change that has been noted has been the emphasis on prevention strategies for people who are infected with HIV. Now, let me just say, CDC has made prevention for positives a priority for at least a decade. Jurisdictional community planning groups had to prioritize prevention for positives as the #1 population for years. Now, although HIV positive was the priority, doesn't mean that funding or prevention-related activities follow suit in every jurisdiction. Now jurisdictions will not only have to prioritize HIV positive individuals on paper, but they will have to submit a plan 6 months into the funding cycle that shows how they will implement programs and activities geared towards HIV positive individuals, as well as testing strategies, condom distributions, and so on. So, how does all of this, the funding announcement, the strong emphasis on care as prevention, how does it affect African American agencies? The answer is, I don't know yet. Maybe some of you have more insight. If so, please share your comments. I have had a chance to speak to several of my colleagues who are executive directors of black organizations before I posted this blog. And some of the directors are talking about having to close their doors in 2012 because of how the state will now fund organizations. Some have mentioned that they're going to have to downsize their organizations or eliminate their interventions programs that focused on high-risk negative because they won't receive enough funding for that specific category to sustain it at its current level. Yet others have talked about merging with federally qualified health centers, since the organization brings the expertise and knowledge of the population and the health center has the expertise in medical care, that this may indeed be a great marriage for the two. But how did we get here? And how did long-standing black agencies start discussing closing their doors in a state or jurisdiction where there was an increase in funding? The real question is, who's to blame? Well, you'll have to log on to part 2 of the discussion to find out who I think is at fault for the drastic changes that African American agencies have to make. Remember, history will record our commitment to stop the spread of HIV and AIDS. God bless.